Have you noticed your hair starting to thin? Maybe your part looks wider than it used to. Maybe you're shedding more in the shower or seeing your hairline slowly recede in photos. Hair loss affects millions of men and women, but it's not just about appearance. For many, it affects confidence, identity, and even emotional well-being. At Origen Clinics, we take that seriously because behind every person struggling with hair thinning is someone who's tried the products, searched the shelves, and been told it's just part of getting older. But that's not the full story. Why does hair loss happen? Hair grows in cycles, and every hair follicle on your scalp goes through a growth phase, anagen, a rest phase, telogen, and a shedding phase, catagen. At any given time, most of your hair should be in the growth phase, but when stress, hormones, inflammation, or poor circulation disrupt that cycle, more hairs start entering the resting or shedding phase prematurely. The follicles shrink, the hair thins, and eventually it stops growing altogether. This process is called miniaturization, and if left unaddressed, it can lead to permanent follicle dormancy. That's where stem cell therapy comes in. What makes stem cell therapy different? Instead of forcing your body to grow hair through chemicals or surgery, we use regenerative cell therapy to help your body do what it was designed to do: repair and restore itself. Stem cell therapy doesn't give you new hair. It helps reactivate the follicles you already have by improving blood flow, reducing inflammation, and stimulating regenerative signals directly at the root. It's like giving your scalp the environment it needs to thrive again. What to expect from treatment? This isn't a quick fix, and we're not going to promise overnight miracles. But for most patients, noticeable improvement begins around 4 to 8 weeks after treatment. You may see less shedding, stronger hair strands, improved texture, or new baby hairs in thinning areas. Results continue to build over time as your body regenerates naturally. The treatment itself is minimally invasive, virtually pain-free, and requires little to no downtime. Most patients return to their normal routine the same day. Stem cell therapy works best for people with active follicles, even if they're weak or dormant. If you still have hair, even if it's thinning, there's a good chance your follicles can be stimulated to grow stronger again. That's why we always start with a consultation. We want to understand your health history, the root causes behind your hair loss, and whether this approach is a good fit for your situation. At Origen Clinics, we don't treat symptoms. We treat systems. We believe regenerative medicine represents the future of personal health. Our approach is evidence-based, patient-first, and completely customized to your body's biology. We're here to guide you through every step, from understanding your hair loss to exploring the safest, most effective ways to restore your confidence. Visit origenclinics.com to learn more or book your private consultation today, because your hair and your confidence are worth protecting.